So here's what I want to know. How many patients have you watched walk out of your office feeling great and then just never come back? Not because something went wrong, not because the treatment didn't work, because nothing happened after that visit. No follow-up, no reactivation, no system pulling them back in before they forgot they still had 8 sessions left on their care plan. If that number is more than a handful, keep watching, because that's exactly what we're getting into today. I'm Kevin, I'm with Pro Sulum, and today we're talking about building real retention systems inside a chiropractic practice. Not tips, not send a newsletter, actual documented systems that run consistently, generate revenue from patients who would have otherwise walked away, and can be handed off to someone else to operate. Let me put some numbers on this first, because I think it helps to actually see the scope of the problem. The average chiropractic patient drops off somewhere around visit 6. 6. Not because the relationship broke down, not because they had a bad experience, because they hit what I'd call the early pain relief paradox. Pain brought them in, pain reduction signals to their brain that the work is done, so they stop coming. The care plan called for 14 visits. They came back for 6. From a pure revenue standpoint, you captured maybe 40% of that case. Now, scale that across 100 patients a month or 200. The math gets uncomfortable fast. And then on top of that, no-shows. Industry data puts no-show rates somewhere between 10 and 30% across chiropractic practices. If you're seeing 200 patients a month and 20% of them don't show up or cancel without rebooking, that's 40 patients per month disappearing into scheduling friction every month. Not because they dislike you, because nobody followed up. Practices that run automated recall systems, patient reminders, reactivation emails, structured follow-up sequences, they cut no-show rates down to under 10%. Under 10. That's not a small improvement. That's a completely different practice. So why don't more practices have these systems? Because someone has to build them.
That sounds obvious, but I want you to sit with what that actually means. Someone has to write the reactivation email. Multiple versions, segmented by how long the patient's been gone and what their care history looks like. Someone has to figure out the timing logic. Someone has to set up the triggers. Someone has to test whether the thing actually sends. Someone has to monitor whether patients are responding and adjust the messaging when they're not. That person is usually nobody, because your front desk staff is already at capacity answering phones, checking people in, handling insurance, fielding the billing calls. They are not building CRM automations between check-ins. And you're in the treatment room. You're not building them either. This is not a motivation problem. It's a bandwidth problem. And it's not one of those things where you just block out 2 hours on a Friday and knock it out. The system has to get built, documented, and maintained over time. That's ongoing work. And ongoing work needs an owner. So here's what that owner looks like. This is where the whole thing actually changes. The person who builds and runs a retention system for a chiropractic practice has a specific name, a VSA, a virtual systems architect. Not a virtual assistant, not a task taker who follows a checklist and comes back with questions every hour. A VSA documents the process, builds the system, and then owns it. That's the whole thing. Here's how that's different from what most practice owners try. When you hire a task taker, you are still the brain. You are still deciding what needs to happen next, answering questions, catching mistakes, holding the whole operation in your head. You're just outsourcing execution. That's helpful, but it doesn't scale. A VSA comes in and shadows how things are actually happening in your practice, even if how things are happening lives mostly inside your head. They pull that knowledge out and turn it into something documented, repeatable, and runnable by someone other than you. Then they build the tools around it. Then they run it. So when I walk you through the specific retention systems that move the needle in chiropractic, I want you to hear all of it through that lens. These aren't things you need to go figure out how to build. These are things a VSA builds and owns. First system, the early exit intervention.
This is probably the highest single ROI move in chiropractic retention. You are looking for the signal right around visit 3 or 4 that a patient is about to decide they're done. Pain relief is the trigger. When someone says, "I'm feeling so much better," that is a yellow flag, not a celebration, because without an active response at that moment, there's a real chance they don't come back for visits 5 through 14. The intervention doesn't have to be complicated. A structured conversation script at that visit, an automated message that goes out within 24 hours of any appointment where a patient logs significant improvement, a plain language breakdown of the difference between feeling better and being done. That explanation alone changes how patients think about the next appointment. A VSA builds this flow, writes the messaging, sets up the trigger logic, tracks whether the early exit patients who receive the intervention actually come back at higher rates, adjusts what's not working. Nobody's coming to you with a question every time a patient says they feel better. The system handles it. Second system, reactivation. Your dormant patient list is probably the most underutilized revenue asset in your entire practice. Everyone who hasn't been in for 60, 90, 120 days. Most practices have hundreds of these people, some have thousands, and most practices do nothing with them because nobody has time to work that list. A proper reactivation sequence isn't a generic "we miss you, come back" email blast. That doesn't work. A patient who dropped off after 2 visits needs a completely different message than a patient who completed 20 visits and just got busy for a few months. The segmentation matters. The timing matters. The specific call to action matters. All of that gets built out by a VSA, tested, maintained. When one of the sequences stops performing, they adjust it, not you. Third system, the referral pipeline. Chiropractic is one of the most referral-driven healthcare categories there is. Your best source of new patients is existing happy patients. But happy patients don't automatically send referrals. They do it when you ask, when you make it easy, and when there's some kind of follow-through that closes the loop. Most practices don't have a system that consistently asks for referrals, tracks who came from where, and acknowledges it happened. Not because they don't know it matters, because building and maintaining it is another ongoing project. A VSA owns that project. Let me give you a concrete example of what this looks like when it's actually running. A healthcare practice, I'm keeping it anonymous, but this is a real situation, was averaging patient drop-off right around visit 4. The front desk team was spending about 3 hours a day doing manual reminder calls. The doctor knew that care plans worked when patients followed through. The attrition was brutal, and she knew it. What fixed it wasn't new software, wasn't a rebrand, wasn't a marketing campaign. What fixed it was getting one dedicated person to build and own the patient communication systems. Reactivation cadences at 60, 90, and 120-day intervals, birthday touchpoints, post-visit educational emails between appointments explaining in plain language why continuing the care plan mattered even after the pain went away. Early exit intervention messaging triggered around the visit where significant improvement first got logged. When all of that was running consistently, not just for 2 weeks and then falling apart because nobody maintained it, the average drop-off shifted from visit 4 to visit 9. Patient lifetime value effectively doubled. The doctor went back to just seeing patients. That was it. On the economics, I'll be direct. Pro Sulum has VSAs working in over 40 industries right now. Healthcare operations is not a new space for us. These are not entry-level people. And they come in at roughly half the cost of a full-time in-house hire when you factor in salary, benefits, payroll taxes, all of it. So you're not paying a premium to get this done. You're saving money compared to hiring in-house, and you're getting someone specifically trained to build systems, not just take tasks. For chiropractic specifically, the retention math is pretty compelling. If your average patient lifetime value is around $2,000 and a properly built reactivation system brings back 10 dormant patients a month who would have otherwise been lost, that's $20,000 a month in recovered revenue from one system alone. Not from ads, not from a lead generation campaign, from patients already in your database. Here's the quick version of what we covered. Retention breaks down at the early pain relief stage. No-show and drop-off are bandwidth problems, not awareness problems. And the fix is a VSA who documents, builds, and owns your patient communication systems so you're not the one holding it all together. The links to learn more are in the description. Everything's down there, check it out. If this hit a nerve, click the link in the description and book a free discovery call with our team. No pressure, no pitch, just a real conversation about what your practice specifically needs and whether a VSA makes sense for where you're at right now. And if this was useful, hit subscribe. We do this every week. See you in the next one.